Hi, my name is Josh Spitnail, and I'll be talking about direct access and how it relates to physical therapy. So first I'll talk a little bit about what is direct access. And direct access, it allows patients to come to physical therapy without a physician referral or prescription. And oftentimes in Indiana and specifically, there's a visit limit and sometimes there's a time limit. So like how many days, and in Indiana, we can see patients in physical therapy for 24 days without needing a referral from a physician. Direct access, it helps limit barriers, and one of the main barriers to healthcare is access. So it helps limit access because patients can come straight to us without needing to make another appointment to their physician. So this is really big for physical therapists because we can kind of generate our own business instead of relying on physicians and other types of doctors to refer patients to us. Now patients can just come to us and we can kind of create our own business and patient population from that. Next is the impact on direct access on physical therapy. So I'll talk a little bit about the history. So direct access, it was first established in 1957 in the United States. The first state was Nebraska. And then in January in 2015, all 50 states had some form of direct access for physical therapy. PTs, they now can be the first line of treatment, so that's big for us. It's leading to more initial evaluations and more patients coming into the clinics. So they don't have to, again, like I kind of said earlier, they don't have to find a physician and make an appointment for that and then come to us. It might be too much work for them. No, they can just come straight to us. We need to be aware of what we can and cannot do without a referral. So I'm pretty sure this is nationwide, so we need a referral for spinal manipulations and also sharp debridement. And then there's national and state laws and regulations that we as physical therapists have to be aware of. There are new laws for direct access that are coming into the physical therapy world in July. And I think one of those is that instead of 24 days, now it's widening to, I think, 48 days, so that's good for us. We can see patients for more time without needing a referral from a physician. And then it's now important than before, direct access to refer out as needed and make sure that we don't miss anything crucial or critical for our patients. Since they might not be seeing their physician first, it's important for us to make sure to have a thorough screen of the patient and just make sure that we don't miss anything, so we don't harm the patients, and if we find something, then we need to refer out to whoever it needs to be to. So financial planning, it can help lower the cost for the patient and increase their access to healthcare. Just come to us first with direct access. It can also increase the patient population and increase the revenue and the money coming into the clinic. Insurance may require a referral from the physician, so it's kind of important for PTs and also the patients in the front desk to know what is required of them before they see us with their insurance company. Some require referral. And then one article that I found, and they found that direct access was more effective, displaying better outcomes at discharge when compared to a referral to physical therapy by a physician. And then they also reported that the percentage of patients who fully reached their goals at the end of the treatment was 9% more in the direct access group than the referral group. So management. It's important for management to look at the PT to PTA ratio. If we are seeing more initial evaluations because of the access to healthcare with direct access, they might need to be more PTs to PTAs to do those initial evaluations, depending on the clinic and the size. And we also have to make sure that all staff knows about the laws and regulations for direct access. Kind of how I mentioned earlier, insurance companies might be different, and the new laws that are changing in July, they have to maybe have like a meeting about that, or maybe just monthly meetings to make sure that no one's missing anything. They have to make sure that their policy and procedures are up to date, especially with the new change coming in July, and just making sure to write policy and procedures that are with direct access, and making sure their patients get everything they need. And I feel like with direct access, it's still important to keep a good relationship with the physicians, even though they might not be referring people to us. We still need to keep that good connection and communication with them, because we might need them at some point. So marketing and patient satisfaction. Patients, they may not know that they can come to physical therapy without getting a physician referral first. So it's important to market or advertise direct access to the patient population. Patient satisfaction is also important because word of mouth might kind of spread around of how people can learn about direct access. If a patient had a good experience, they could tell friends that they know, and then the friends will tell friends that they know that, hey, you don't need to see a physician before seeing a physical therapist. So just making sure that the patients have a good experience with you. Here are some barriers that I found on the APTA website. I think there was about 5,000 PTs that were involved in this study and survey, and here's kind of the top reasons why. What are some of the barriers of direct access? And the top ones kind of being reimbursement concerns and lack of marketing skills and resources. And then there's the list there of the percentages. And does anyone have any questions? No? Here are my references. Thank you.